following video is our project from the I Am Healthy team. Our objective was to develop a collaborative approach to integrated medicine with the Mary Washington Hospital Cancer Center. For the past 6 months, our team of 7 have grown into a team that is prepared to present to you our findings in meeting our objective. This dramatization is an example of what a practical situation of integrating our findings at the Mary Washington Hospital Oncology Center. Our story opens with Jamie and Jennifer. Jamie is a patient who's been diagnosed with cancer. Jamie's on his way to the hospital for his routine treatment. But before his treatment, he's going to meet with the navigator, Jennifer. As Jamie's navigator, Jennifer's responsibility is to introduce Jamie to the various programs of integrated medicine that Mary Washington Hospital Oncology Department now offers. A much more comfortable experience for Jamie is about to begin.
How are you? How you doing?
Good.
We're going to take a look at this book real quick, since we're going to be talking about some of these things today. This is yours to take home, and I'll actually give you another one for Samantha as well. And today we're going to meet with the doctor and just briefly go over things and meet with a couple people of some services that you might be interested in. And if you follow me, we're going to go visit the doctor and do your therapy for today.
Great, thank you.
How you doing, Jamie? Good to see you.
Good to see you.
How you feeling?
Pain's still there.
Yeah.
Insomnia's pretty bad.
Yeah.
So, hoping for something new.
What we wanted to explore today was what we call integrative medicine, or alternative medicine, or complementary medicine. It goes by many names. And I know we've chatted a little bit about, but I want us to just have a dialogue for a few minutes about integrative medicine. And then we'll wrap up, we'll walk down the hallway and I'll introduce you to a couple of our therapists. And Jennifer, who your navigator, she'll be there as well. And we can continue our dialogue down there.
Great, thank you. Is this what they've called holistic medicine and Eastern medicine, China and those things?
These alternative therapies go by many different names. One of the challenges we have in the medical community is you have 3 different cultures coming together here, the physicians, the therapists, and the patients. We all speak separate languages. One of the concerns that traditional physicians like myself have oftentimes is that the patients will seek alternative medicines without keeping us informed. So by coming together here at Mary Washington, who are one of the first in the nation to do this, we get to ensure that we are one team with one plan for your treatments. So Jennifer is that kingpin to ensure that communication is going back and forth.
But it sounds like you're supportive of integrative medicine, and the hospital is too, which is relieving to me.
Absolutely. As I said, there is a lot of resistance in the community of physicians. I think most of that concern is well intended. It is an education issue where we need to educate physicians. Here at Mary Washington, we've embraced it fully. We have full-time navigators on our staff. We have full-time therapists on our staff, which you'll meet in a few minutes.
Well, credit goes to Mary Washington Healthcare Cancer Center for having that one team, one plan program. I appreciate that.
Thank you. Some of the concerns, and you'll hear this again and again throughout our conversation this afternoon, is communication. As I said, physicians are concerned that you'll go off and seek alternative care without keeping us informed. It's absolutely essential that we communicate amongst the entire team. Jennifer will be that source of synergy between the team members, but you and Samantha as well.
What other treatments are out there? You mentioned those 2. Are there others that I should be thinking about?
Well, given the symptoms that you've described to me earlier, the insomnia, the pain, I think that perhaps yoga and massage might be where we look first. There's an entire suite of alternative or integrative treatments that are available all the way from treatments that are on the fringe of traditional medicine, such as chiropractors, and then you start moving away from that to less traditional, but massage, yoga are becoming more and more accepted as value-added treatments. Art therapy, running, just exercising. There are any number of treatments that you and I and Jennifer and the others can explore.
Herbalistic remedies.
Absolutely.
I guess are in there.
Absolutely. And that would be where you get into what you said at first, the Eastern style of medicines.
Great. Well, I look forward to getting started. Thank you.
Well, let's head down the hallway and meet Jennifer and the therapist.
Great.
Jamie, as we were discussing in my office a few minutes ago about introducing you to the idea of integrative medicine, I wanted to get us all together in one room and have a conversation about integrative medicine. So I brought you together again with Jennifer, your navigator, who I think you know pretty well, and two therapists that we are currently engaged with. Jennifer, if you want to jump in.
After speaking with the doctor, and he kind of explained us some more, therapies that we have to offer, how are you feeling? A little bit scared, a little nervous?
A little bit skeptic of the whole IM practitioner suite that you're describing, but frankly, I'm willing to try anything. Short of going to China or India on my own, but I'm open to it.
Well, one thing to acknowledge, and these types of services, they're not your traditional medical types of services. They're more for comfort. They're called complementary services because they're complementing the services and the treatments that you're going through with the doctor right now at this time. So not to be confused that it's going to be something that's going to heal you, but it's something that can make you a little more comfortable during the process and things like that.
Quality of life.
Yeah,
morale.
quality of life, which I'm sure that you'd really like to get back a little bit, huh?
Back to normal.
Please think of this as your own journey. You may go out and talk to other people or go to conventions or conferences or meetings and things with other people that are going through the same types of things that you are. And you might hear, that they're doing one type of thing, and, we just ask that you communicate with all of us so that, we all know what's going on with Jamie and that we're making sure that you're staying on the right path so that if you do decide to go with, some other types of therapies or alternative medicine types of things, that it's not compromising what the doctor has going on for you right now.
And if I could jump in for a second, I'm glad you brought that up, because that's probably, if we want to walk away from the table with any theme in mind, it's that we are all a team with one common goal, and that is to see you cured of this cancer that you have. So it is a team effort of talking to me, of us talking to you, to Jennifer, to the therapist, to Samantha. She should probably be part of this. So whatever treatments we end up selecting for your IM therapies, Samantha should be a part of that as well.
Great, thank you. And Jennifer, as my navigator, you're my sort of single point of contact clearinghouse for all of it and helping me through each step.
Yeah, you can kind of think of me as like your file. I'm here to manage and coordinate your doctor office visits and take a look at your tests when they come back to make sure that we don't have any conflicting things going on within you, so that we can make sure that you stay healthy and that everything that you're doing ends up working for you and not being compromised by mixing different types of therapies and medicines and things like that. So I'm your direct source of contact for you and your family for support and any questions that you may have.
Great.
Yeah.
JR mentioned earlier that there's a number of different IM therapies out there, two of which were yoga and massage therapy. I think that would be a fit for my two biggest issues, pain and insomnia. So I think that's the path I'd like to go.
That's when we brought in Lisa and Nicole. Nicole actually specializes in the yoga therapy, and Lisa specializes in the massage therapy, and they're here to speak with us today too, to see if we can get started on a couple of those therapies.
Great. Thanks for coming.
Jamie?
Lisa,
Nice to meet you.
you. Oh, Jamie, very nice to meet you. Sorry, under such circumstances.
Yeah.
Jamie, massage oncology or oncology massage helps you cope with some symptoms you're experiencing with your current treatment, whether it's fatigue or pain. Any of that it's going to help you with it. It also helps you with emotional distress, like stress, depression, fear, and I know you're probably experiencing all the above. We're going to develop a comprehensive plan to treat you with your traditional treatment in mind, your yoga treatment, massage. It's going to be customized just for you, just for Jamie. We're going to develop a plan that benefits you all the way around, and we're going to integrate all of your treatments to make it one big giant recovery plan for Jamie Scully. So do you have any questions about massage therapy?
What's the difference between regular massage and oncology massage, if there is a difference?
There actually is a difference. There is an oncology massage certification that you can obtain. And you know, if you go too far into the tissue, it could actually negate or counteract the treatments that you're receiving. So there is a certain way that you need to be massaged, and certainly as your massage therapist, I need to be aware of where the tumors are, because I don't want to mess around that area. So there is a big difference. You need to make sure that you're going to a certified massage oncology therapist.
That makes sense.
And just a little bit about yoga. My background, I've been doing yoga for quite a while, and I've actually gone to Duke Medical Center, where they have a very progressive training program on yoga and cancer treatment. So I've been very involved with that, very involved in the community. And the whole purpose behind yoga is to introduce you to techniques and methods that can help you reduce the pain, the stress, the anxiety. What I can show you are things that you can use while you are in therapy, while you're receiving chemotherapy, breathing techniques that can kind of relax you so that the treatment will work a little quicker, but also stretches and meditations and therapy and yoga practices that you can do at home when you feel pain or when you feel stressed or unable to sleep. So it's working with your doctor through the navigator, trying to find out where you are in your treatment, and then introducing those kind of techniques that will help you. Before starting this program, you guys had some sort of accreditation scoring system, sort of like you do for regular physicians. So this group has been vetted and they're professionals.
That is correct. It's been a long process, and we've came up with qualifications for the providers to have when they did come on board, and it's been very well thought through.
I've met some other people in my same situation that have had it elsewhere. I'm glad to get it all within the suite. I feel more comfortable doing it through you. We are working as a group, and because you're going to be working with Lisa and I and perhaps some other therapies, we can then introduce you to other individuals who are dealing with the same issues.
Like Nicole said, we're here to help you.
I like my team.
6 weeks later, after alternative-assisted therapies of massage and yoga, Jamie's experience and mood have improved. His overall quality of life has enhanced, and he's able to tolerate the radiation treatment much better. We'd like to thank all who assisted in our project. Our sponsor, Mary Washington Hospital Cancer Center and Whit Yellerton, our mentors, Jamie Smith and Amanda Talbert, all of the participating cancer centers and integrated medicine practitioners who provided the information and phone interviews for us. I'd also like to thank our team leader, Lisa, and all of the supporting cast, Jennifer, Samantha, Nicole, Jamie, and JR. Thank you very much.
Mary Washington Healthcare Cancer Center.
One team, one plan.